Hello, and thank you for joining us for today's hybrid education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Exercise Recommendations in Cancer. Before we begin, if this is your first time joining us, CSC South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down anyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join our community, please visit our website at cscsouthbay.org. Without further ado, before I introduce today's speaker, we ask you to keep your microphone muted to eliminate any distracting background noise. For those online, and please feel free to enter any questions into the chat function found at the Zoom window. We can get to them at the end. And then for those in person, if you can hold your questions till the end.
There's no water? They didn't have any outside?
Without further ado, I'd like to introduce our workshop speaker. Dr. Philip Chang, DO, is an assistant professor in cancer rehabilitation medicine at Samuel Oschin
They must have
Comprehensive
some
Cancer
outside. They had lunch,
Center
I
at
feel like, yeah.
Cedars-Sinai Medical Center. He completed a residency in physical medicine and rehabilitation at SUNY Downstate, followed by a fellowship in hospice and palliative care at Montefiore, and a fellowship in cancer rehabilitation at the University of Michigan. He has published on various topics in cancer rehabilitation and works with the Cancer Rehabilitation Physician Consortium of the American Academy of Physical Medicine and Rehabilitation. Thank you so much, Philip, for being here with us today.
Muted myself and unmuting myself. I'm going to assume that this is working and everyone at home can hear me. Becca, let me know, I guess, if they can. And, oh, you think it's slow? Okay. All right. Maybe. Oh, I think they're listening. They're probably test listening, so I'm sure they'll be able to hear me if they can. Anyways, thanks everyone. You're good? Okay. All right. We're good. Okay. Anyways, I'm Phil Chang. I practice physical medicine rehabilitation, and specialize in cancer rehabilitation medicine at Cedars-Sinai. Although I also have a clinic a couple times a month at Torrance Memorial at the Hunt Cancer Center here as well. But thanks everyone for joining. Thanks everyone at home for joining. And yeah, I hope this session can be useful, and that maybe you'll hear something that you haven't before. So we're going to be discussing for this session exercise recommendations in cancer. And if I need to speak up in the back, if you can't hear me, just let me know. Okay, so quick overview for what we're going to be discussing today are the effects of deconditioning. So just like, kind of being sedentary and not moving around, the danger of falls, benefits of exercise, exercise and neuropathy, as well as exercising safely. And then we're just going to finish by going over a bunch of easy exercises that you can do with just resistance bands at home if you're not doing something to just get started, because it's always no time like, today to get started on something. Okay, so when they originally were studying like the effects that going to outer space would have like on the human body, they would just have people just lay in bed because they were testing like, how being, gravity not affecting you would what that would do to your muscles. And basically what they found was that it's really bad. And as you imagine, your muscles can shrink and they decrease. And for 9 healthy males, in this really old study that they did in the 1980s, they had them just lay down and best horizontally. And they found that after 5 weeks of bed rest, their calf muscle area decreased by 12% and their muscle strength decreased by 26%. So, not like small numbers here. In a different study, they had 10 healthy adults and they put their arms in casts for 4 weeks. And again, they measured the volume of their muscles after that period of time, and they found that they lost 11% of the muscle volume and the force and their strength in their arms decrease by 35%. And that's just what happens when you're not using your muscles. They will just shrink physically in terms of volume, and you'll also lose significant muscle strength. Um, so we know that just basically laying down in bed, it's bad for you kind of all across the board, not only in terms of decreased strength, where again, we talked about loss of muscle mass and loss of muscle strength, and that can happen in a matter of days. And then you also have changes, negative changes to both your heart system, your cardiovascular system, as well as your lung system, your pulmonary function. So what happens is your blood volumes actually decrease. So you just have less blood flowing around in your body. The amount of blood that your heart is able to pump out to the rest of your body, that decreases with every beat. And that's what we call the stroke volume. The amount of oxygen that your muscles are able to take out of your blood, that decreases. And your chest's ability to expand, to let in more air and get more oxygen to your body, that decreases as well. So lots of negative effects of being immobile and not exercising regularly. And then additionally, we know that the less exercise you get, the less active you are, that there's a correlation with fall risk there. So falls are the leading cause of morbidity and mortality in older adults all across the world. And they're the leading cause of injury-related death in older Americans. And for Americans over the age of 65, it's estimated that over 25% of them will have a fall every year. And out of those people, 20% of them will have a fall that results in a broken bone or significant head injury. And this is common. You go to any emergency room across the country and somebody will be there for something like this. Just really, really common. 79% of falls occur in the home, typically in the bedroom, stairs, or bathroom. Really, really common, I would say, for people to wake up in the middle of the night to go to the bathroom. And then, it's dark, you can't see. And then, they fall on their way to the bathroom. So significant risk factors for this. If you have a fear of falling, you're not like 100% confident in your ability to walk around without falling, or if you have a slower walking speed, or if you've previously fallen, those are all like pretty significant risk factors that you're going to have another fall in the future. Yes. Yes. Okay. Is this okay? All right. Let me know. Okay. Fantastic. So, yeah, if you have any of these things, fear of falling, previous falls, your walking speed is slower, then this is something you should be concerned for. And it's something you should be taking active steps to address honestly now. Okay, so again, consequences of fall, head injury, broken bones, you end up in the hospital. And then if one of these things happens, if you like break your hip, it's not just you're in the hospital, they fix your hip and then you go home. You're there, it's very reasonable chance you get placed in like a skilled nursing facility for rehab, and you could be there for like months potentially. So this is not like, a small fixable thing. This is like a major thing to be concerned about. So, we have a lot of different things that give us our sense of balance, but to oversimplify it, the things that allow us to maintain our balance are our somatosensory input. So that's like the vision that we're getting from our eyes, or our sense of equilibrium from our ears, our motor function, which is our strength, our cognitive capacity, as well as our ability to navigate the environment. So if any of these things are off, then we're going to be at an increased risk for falling. So again, our vision, this is really, really important. If your eyeglass prescription is out of date, then make sure that you get that set. If you've never had that checked before, but you have trouble seeing, this is absolutely something that you have to take care of. Vestibular function, also really important. So this is a diagram of the inner ear, and basically there's like these little hairs in the inner ear that, like, depending on what your position is, those hairs move a little bit, and that basically gives you your sense of equilibrium. So it's like when you're on a boat, or rocky ground, like on the water or something, then the hairs shift and you feel off balance, and then you get nauseous. That's all your sense of equilibrium from your vestibular function. Now your proprioception is your body's ability to know where your muscles and joints are in three-dimensional space without you looking. So, I'm not looking. I know my finger's up. I know it's down. I know it's up again. And that's an ability that just comes from your nerves. So anybody that has nerve damage from chemotherapy, this is probably something that's lacking, and it's probably one of the biggest contributing factors to people having poor balance and falling, especially when they're having recently received cancer treatment or currently receiving cancer treatment. And then our motor function, of course, we need strength in our legs to be able to, maintain our balance. Yes, you have a question? Mm. Sure. So the question was, after you get chemotherapy, how long do those effects last that will affect kind of your nerve function as well as your ability to maintain balance? So essentially, very good question. Thank you so much for asking. It depends. So it depends on the kind of chemotherapy you received and depends on how much of the chemotherapy you received. So tends to be a cumulative effect. So the more cycles, the higher your dose, the worse the toxicity to your nerves. That said, in most cases, for most individuals, it should get better after 3 months of finishing chemotherapy. That said, there are a lot of people who will continue to have effects um, of neuropathy after 3 months. And in that case, I tell people, you know what, you might have to wait a little bit longer, like 12 to 18 months. And then there are still people who have neuropathy effects after that. And if that's the case, if it's been like a year and a half or longer since you finished chemotherapy, but you're still feeling this, it's likely to be persistent, the neuropathy symptoms. Now, that said, it can still get better over time. I've seen people with neuropathy so bad, like in their fingers and their hands, they can't tie their shoes. And that was 9 years after chemotherapy. They still can't tie their shoes. But it got better to the point where year 10, they could tie their shoes again. So just because it's been years, it doesn't mean that you can't still get better. And for things like falls and balance, you can kind of overcompensate by optimizing your nerve function that's not damaged and optimizing your strength in your legs. So you can still improve the balance that you have now, even if you have nerve damage from neuropathy. But thank you so much for that question. I wouldn't say that. Yeah. So the question again was if you can get 100% back. I wouldn't say that. I would say that that's less likely. But I would say that the trend seems to be as long as there's no new problem affecting or damaging the nerves, such as diabetes or a vitamin like B12 deficit or alcohol use, then it can improve. How much it can improve, it's difficult to say and variable. Okay, quick note about center of gravity and mass. You can kind of consider your center of mass to be like maybe a couple inches behind your belly button, but the point is that we think about our base of support. So the base of support is like the outline around your feet. So as long as your center of mass, which again is maybe a couple inches behind your belly button, as long as that's within your base of support, you literally just won't fall as long as your legs are strong enough to hold you up. As soon as your center of mass falls outside of your base of support, then you'll lose your balance and you'll fall over. And that's why things like canes, or walking sticks or walkers are helpful because they increase your base of support, and just by walking with a wider stance. So if I have my feet far apart right now and I move from side to side, I can move a lot more because, again, I'm increasing my base of support. So just something to think about in terms of walkers and canes. Okay, so let's talk about the benefits of exercise. So we went over the detriments of kind of not moving around and what happens to your body if we're more sedentary. Now, what happens when you exercise? So, the kind of phrase that's thrown a lot in hospitals and clinics a lot is that exercise is medicine. And exercise is medicine for basically your entire body. And I don't think that's an overstatement. So exercise is medicine for your heart. So what this means is if you have a high heart rate, exercise exercising regularly will decrease your heart rate. If you have high blood pressure, exercising regularly will decrease your blood pressure. If your blood pressure is normal, it's not going to like make it go down to a dangerous level. It'll just keep it there. If you, like we talked about, when you don't exercise, your heart's ability to pump blood to your body gets reduced. But if you do, it can get increased again. And it can also decrease the amount of oxygen that your heart needs itself to make your heart more efficient at using oxygen. Exercise is medicine for your lungs. So, like we said, if you're sedentary, your lung volume will be decreased. But the more you exercise, the more your chest will be able to expand and your lung volumes can actually increase, meaning you get more oxygen flow to the rest of your body. And exercise, of course, is obviously medicine for your muscles. So glycogen is basically energy storage that's in your muscles. And the more you exercise, the more that storage capacity in your muscles gets increased. It makes your muscles more efficient at using that energy. And of course, you will gain strength, which you can use to do things like, walk around faster or stand up easier or just increasing your endurance for being able to spend more time in the park or out shopping or visiting family or friends. So we know that in addition to these things, there's a lot of evidence that exercise helps with things like fatigue, anxiety, depression, bone health, sleep quality, and these are all in people with cancer. Lots and lots of studies have shown these things. And we know that if you are possibly going to be undergoing surgery for cancer treatment. There are many, many studies now, particularly in the past 15 years, where that shows that prehabilitation, which is basically exercising before you undergo surgery, can be extremely beneficial. So if you look at this graph, we have like a baseline level of function in the middle, and people who exercise, their functional capacity and their health overall increases because we expect that when you undergo surgery, your health capacity will decrease. That's just kind of like a known. So if you have, while you're still feeling okay and relatively healthy and you exercise before that, then the decrease that you'll experience after surgery hopefully won't bottom you out to such a level where you feel really, really bad. As we can see kind of in the lower part in people who don't undergo prehabilitation. So it's really, really helpful before surgery. And for preventing falls, so multiple studies have shown that people who exercise specifically with balance exercises and leg strengthening, you can reduce your fall risk by 24% in this one study or 34% in another study. In Tai Chi, if anybody's interested in Tai Chi, that's also specifically been shown to decrease the rate of falls in people who practice that. And then this is another really important one. So this is a pretty recent study, came out a couple of years ago. But for anybody I recommend this for all of my patients now, but anybody who's going to be starting chemotherapy that we know can damage nerves, and that's medications like vincristine, carboplatin, cisplatin, paclitaxel, Taxotere, many others. But any medications that you're going to be receiving that can damage your nerves, and your oncologist will tell you, you should be doing balance exercises. So this study showed, this was actually a study that was done in people with, I think it was mostly like lymphoma and leukemia type cancers. Mostly they were receiving vinca alkaloids, so medications like vincristine or vinblastine. But what they did is they divided them into three groups. One group didn't do anything. They just, did what they just didn't do any extra exercise. The other group did vibration therapy on a vibration plate, and the third group did sensory motor training, which is basically balance exercises, essentially. And what they found was that the higher, those higher bars over there basically indicate that more people got neuropathy. So we can see in the treatment as usual, the TAU group that didn't do any specialized training, they had much higher rates of neuropathy, like close to 60, 70%. Whereas the patients who did the sensory or the vibration therapy, they had much lower rates of neuropathy, like 40% or less. And the best group was the ones who did that balance exercise training, and they had rates around 30% or less. So that's clearly the best one. And these are not small reductions, like to have a reduction from 70% to 30%. That's like really, really big. So I can't emphasize this enough, especially if you're on chemotherapy that's toxic to nerves, or if you're going to be starting it. I would do this like right now. And we're going to talk about how to kind of do that safely. Okay, exercise is medicine for cancer specifically. So lots of research in the past 20 years, mostly in animal models or in petri dishes, and more recently in actual people. But there's evidence emerging that when you exercise, there are things that happen in your body that help it fight off the cancer better. You don't necessarily need, I mean, you do need chemotherapy and drugs to kill the cancer, but in addition to that, your body is also able to kill off cancer cells with its own immune system. And the more you exercise, the better that works. So this is a study that was done in rats, okay? And these little black areas, so these are lungs from rats, and these little black areas are tumors. And they split the rats up into two groups. One group, they gave access to a spinning wheel so they could just run as much as they wanted to. And the other rats, they didn't exercise at all, or they didn't run at all. And then afterwards, they took the rat's lungs out and they counted, like, they saw how much of the lung tissue is there. And you can see the difference. So the EX is the exercise group, and you can see how much smaller, the lung tumors are. And all they did was run more. That's all they did. They didn't get any special medication. Those rats just ran more. Okay. Another similar study. This is in healthy young adults. But they had these healthy young adults do exercise on like a bike, and then they took their blood after they exercised, and then they put the serum from that blood, and they gave that serum to human lung cancer cells. And what they found was that there's something in the blood of these people who just exercised that basically stopped the human lung cancer cells from growing and dividing more. And again, this is just exercise. So again, when we exercise, there's something that is activated in our immune system that directly helps to fight off cancer. And most interestingly, this is oh, sorry, this is the next slide. Okay, well, we'll look at this one too. But exercise has been shown drastically to reduce the risk of developing all these 7 cancers on the left, but increased survival with 48% risk reduction, all-cause mortality in breast cancer, 42% risk reduction, all-cause mortality colon cancer, 38% risk reduction for mortality in prostate cancer. And this is a really big study. A lot of oncologists are talking about this right now. That this was just published last year, but this is a huge study. This was done at many, many different medical centers in over 900 patients. And this is in people with stage 2 and 3, I believe, colon cancer that was resected. And what they found, and they split again the people into 2 groups. One group just got like kind of generic recommendations on physical activity, and the other group was participating in a 3-year structured exercise program where they were basically aiming for 150 minutes of exercise per week. And what they found was these little graphs here are basically showing overall survival and disease-free survival. And the orange line is, the exercise group. The blue line is the non-exercising group. And it's significant percentage change just from exercising. And this is a real life study in real life people who had actually colon cancer that was surgically removed. So all they did was exercise, but they had something like a 28% like increase in survival. And all, they did was exercise. Yes.
That was exercising 3 years in advance. Had they already been diagnosed 3 years earlier with the colon cancer?
Yes. So this was okay. Yeah. So the question was the group that was exercising, were they already diagnosed with colon cancer? And the answer is yes. So this exercise intervention was not started until after they had finished chemotherapy. So they already had surgery, they already had chemotherapy, and then they exercised for 3 years, and it resulted in drastic, significant survival benefits. Okay. So exercise is not just like a nice little thing that we do because all of your doctors say it. It literally helps to fight off like, cancer cells. Yes.
Exercise for that definition, or does it need to be something?
So it depends. In general, okay. Okay, the question was, does brisk walking count as exercise as like related to this study? So, and I said, it depends. Basically, probably yes. So, the way that we define exercise or exercise intensity is based off of your baseline heart rate at rest, meaning how fast your heart is beating when you're sitting, resting, not doing anything, and like basically your maximum how fast your heart is capable of beating. And then and this is individualized, so it's different for every person. So every person has a different range of what their heart or how fast their heart should be beating in order for them to be exercising at a light intensity, at a moderate intensity, and at a vigorous intensity. So for this study, they were going mostly for like moderate intensity, aerobic exercise. So for most people, brisk walking, probably yes, that would be enough. But again, you kind of have to do a lot of it, and you're kind of doing it for extended periods at one time. But another good rule of thumb is if you don't want to be, trying to calculate all these heart rates of how fast your heart should be beating, is you can use your work of breathing as a proxy. So what that means is if you're exercising lightly, that would mean that you can probably sing while you're walking. If you can sing while you're walking, you're probably not exerting yourself hard enough. So you want to speed up to the point where you cannot sing. You're breathing so hard that you can't sing, but you can still talk and carry out a conversation. If you're in that range, then you're probably around moderate intensity. Okay, thanks so much for the question. Yes. The question was if I'm suggesting that yeah, the question is, am I suggesting that if we can do exercise during chemo or after? And my answer is I'm not suggesting that. I'm recommending that. I'm recommending that you exercise during chemo. Now you're not gonna. It's very difficult because it'll depend on like the kinds of symptoms you're having. But most people depending on how often your infusions are, let's say your infusions are every 3 weeks, most people will probably not feel well enough to do this kind of thing the first week after their infusion cycle. But the second week after, the third week after, they might be able to. And as long as you can do it safely, then yes, you should do it. It probably will help you. So yes, I am recommending that. All right. Exercising safely. So there are a lot of different things that we should be considering to exercise safely before we engage in an exercise program. One of them is your platelet levels. So for the vast majority of people, this will not be a problem. But if you have low platelet levels, and I'm talking like below 80, below 70, then it might be, you might want to be talking to your medical teams about what you can and can't do. General rule of thumb, if you're like above 80, then you can probably do whatever you want. Honestly, if you're above 50, you can probably do whatever you want, but I would talk to your medical team. If you're below, that 50 to 80 mark, then, you might not want to be doing things like resistance training with either exercise bands or weights. And then, if you're below like 20 or 10 even, you might want to avoid things like stair climbing or running because we're just concerned about bleeding in the joints. So the point is, I would just say as long as your platelets are above 80, you're safe as far as platelets go. If you're less than that, ask your doctor. I would say is a good rule of thumb. So if you have any of these things, and if you have a recent or new cancer diagnosis, it'll probably mean that you have a worsening or changing physical condition. So if that's the case, again, you should probably talk to your doctor, talk to your medical team before engaging in an exercise program, and just make sure that it is safe for you. Okay, precautions, don't get hurt. So if it's been a while since you've actually exercised or been doing something, you can't just start you can't just jump into it right away and just start going as hard as you can. You will injure yourself. You're going to strain a muscle. You're going to pull a muscle. You're going to strain a tendon, and then you're not going to be able to do anything for weeks until that heals. So you have to start at like the lowest level where you know that you won't be hurt. And this is really particularly in regarding any kind of resistance training. And then you progress slowly. So you just take your time. You don't have to be, because again, the point is we're not trying to like win a race or win a competition. You're just trying to do the minimum amount of exercise you can to get all these benefits for your body that we're talking about. So start low, go slow, and just don't get hurt. If balance is an issue, like if you're standing and walking around, you think you might fall, you have that fear of falling, then you really should probably be exercising in a supervised environment, either with a physical therapist or an experienced personal trainer or exercise technologist. Another thing you could do is, if you have like a healthy person at home who can help you with your balance, there's like these gait belt devices that would allow someone to grab onto you if you're trying to do some exercises, but you are losing your balance. So these are something that can be considered as well. Exercise programs need to be individualized. There's not one thing that everyone can do that'll be good for them. So, it's best to come up, with your own program for, regarding resistance training and, how much you can even start out with in regards to like a brisk walk for light intensity exercise. So, everyone's going to start somewhere different and that's okay. And then, yeah, in general, again, if balance is an issue for you, I do recommend that you work with a physical therapist before you start kind of doing anything else, just because, again, we talked about the risks of falling and all the bad things that can happen with that. Okay, so we're going to now go through a bunch of different exercises that can be done. And again, if balance is an issue, you should be doing it under a supervised environment. But if you're not and you're just looking for something to get started with, we'll be talking about some different things that you can just get started with. So for balance exercises, that we'll be talking about. In general, you want to be holding each exercise for 10 to 60 seconds. And for the strengthening exercises we're going to be talking about, you want to aim for 8 to 12 repetitions and 2 to 3 sets. So we will start going through these. And I'm just going to, yeah, would you mind giving everybody a resistance band? Sorry? Oh, yeah, can I have one too? Thank you. Okay, all right, so this is like one of the first exercises that you can do for balance. Is this on? Can people see me? Okay, so this is really simple. Oh, yes, go ahead. So the question was, is the root cause of everything I'm talking about from exercise or lack of exercise? And I would say the root cause really depends. So, there's many different it depends on like, well, what kind of impairment were you talking about or what kind of problem? Oh, for falling. Okay. So yeah, that depends. It's a combination of multiple things. So the question is, yeah, in terms of falling, what is the root? What are some different root causes? So yes, for falling, I would say most commonly it's neuropathy, caused by chemotherapy or something else, and then deconditioning, meaning loss of strength in the legs, because again, people are really fatigued from undergoing treatment, and because of the deconditioning that we talked about where you're laying in bed like, for weeks at a time and you lose a lot of strength in your muscle. I would say those are probably the most common root causes in cancer. It depends on what you're exercising. So some things for balance, no, you have to be standing generally. Most balance exercises, you have to be standing. So this is one example. So like we talked about before, your base of support, which is the area around your legs, it's easier to stand when your legs are fall apart, but it's harder to, balance yourself when your legs are close together. So, the point of balance exercises is to continually challenge and improve your sense of balance. And by doing that, we bring our legs closer and closer together. So if it's too difficult to, have your feet right next to each other, then you can have your feet a little bit apart. But the point is, you just kind of bring them closer and closer together to challenge yourself a little bit. Now, I do recommend that when you're doing this kind of exercise, you either do it in the corner of a room so you can balance yourself on a wall if needed, or really, again, if balance is a problem, you should be doing it under supervision, preferably from a physical therapist or experienced trainer. But if you do that and they say that you're okay, you can start doing this at home. But your balance is still kind of off, then I would say like a family member or friend should be watching you just so they can like catch you if needed. Um, anyways, so you just like kind of put your feet together as close as you can, and then balance. And you literally just hold this position for like 10 to 60 seconds. And if that becomes too easy, then what you can do is you can get like a foam pad. Some people will use a pillow. Um, just make sure you don't slip. But when you have kind of an uneven surface that your feet are on, that will make it a little bit harder. And then again, you just hold that for like preferably like a minute. But if that's too long, then you can start with something like 10 seconds or for however long you can hold it for. So that's one. So these are some other ways to do balance exercise. So again, if we want to narrow our stance even more for a more challenging exercise, if like having the feet together is too easy, then the next one you can do is the tandem stance balance exercise where you put one foot in front of the other with your heel touching your toe like you're walking on a tightrope. So as you can see, I'm kind of shaky. This is not easy to do. But again, you want to be in this position, holding it for like 10 to 60 seconds about. And again, you can either be doing this in a wall, the corner, so you can grab onto the walls if needed, or you could grab a chair, like they're doing in this picture here. So you practice it behind a chair, and then you just let go of the chair and try. But then if you lose your balance, then you can grab onto the chair. And then the last one on the right, this is, we just call this like single leg balance test or unipedal stance. So again, you're just lifting up one leg and you're just trying to balance on one leg. And again, you're going for like 10 seconds, but you just try to increase the time more and more and more. Now, I said like, you're going for 60 seconds, do both legs. I would say you want to spend maybe 4 to 5 minutes, not a ton of time, but you want to do it regularly, maybe 4 to 5 minutes working on your balance. I would personally say daily, but at least every other day, where you just practice these different stances and these different positions. And then, if these things become to you, I put this here. Yeah. Mm, not the balance stuff. Yeah. Um, just because I don't know what if somebody has like some sort of deficit. So if that becomes too easy, then you can start doing like the star excursion kind of test where you kick one leg out in every direction, like in the points of a star. And again, you do that on both sides. And then you do the other leg, and you literally can just kind of do this for like a minute on both sides. And then the other thing you can do is you can just stand on your heels and you just try balancing on your heels for, again, 10 to 60 seconds, or you can try balancing on your toes, again, for 10 to 60 seconds. But again, for all these balance exercises, if you're undergoing chemotherapy right now that's toxic to nerves, or if you're going to be undergoing chemotherapy that's toxic to nerves, I really, really recommend that you start doing something like this regularly. See a physical therapist if you have to, so they can get you started and make sure that you're doing it in a safe way. Any questions about balance exercises? Okay. Yes.
You're just trying to draw.
Exactly. So you're just on one leg, and then okay, for the star, the question was for the star excursion, are you just drawing a star? The answer is yes. So again, you're just bouncing on one leg, and then you just kind of it doesn't have to be a star, it could be whatever. If you want to do a square, the point is you're just kind of throwing yourself off balance by moving your other leg around. That one's probably different. The question is that alphabet letters that you draw with your leg. That one's probably different. The alphabet exercise is usually when people have like an ankle injury. Yeah, so it's probably different, but you could consider it the same way. Yes, that is a great question too. We're gonna get into that next, but yes, the question was, how about strengthening your legs to improve your balance? Yes, that is one of the key components of improving your balance. And we'll talk about some of the exercises you can do to strengthen your legs, but there are some muscle groups that you want to focus on. And generally, those are your hip abductors, and your hip abductors are the muscles that allow you to move your hip out and your leg out like this. You strengthen these muscles, and that will improve your balance. And then the other really big one is your core. So, that's things like your abdominal muscles and like planking or, doing sit-ups and crunches, that kind of thing. I'm not saying to do any of those, but yeah, when you strengthen your core, that also can improve your balance. Okay, so everybody can do, this stuff if you want to. So if you want to grab your resistance band, then we can all practice these together. But yeah, this is another important exercise to um, in terms of leg strengthening. So this is just for your quads. So, ideally you would yeah, have one end tied to like a chair and then the other one wrapped around your leg. But what I do is this is different from what's shown, but you tie into two holes. So you make a loop around your ankles. Give everybody a minute to do that.
Is that going to be the knee extension?
Yeah, this is for the knee extension. So you make a loop around your ankles and then we'll start with our left leg back and then you just go up with your right leg and then you come back. And so you want it to be low around your ankles. Sorry, oh no, it's fine. Okay. Okay, so yeah, have it low around your ankles, left leg back, and then right leg go up with your knee. And you should feel that kind of working out your quad. And again, for all these resistance exercises, we're doing 8 to 12 repetitions. If it feels like too much, then you're gonna start lower. You're gonna start at like 6. And then after we do however many repetitions we're comfortable with, then we go to the other side. So right foot back, and then we do the left side. And then we can do, you know, 6 to 12 repetitions. And then in between each set, once we do that, that's the set, then we'll stop. And then you'll take generally like a 1 to 2 minute break. And then you do it again for the second set. And then again, we do our left leg back and then make sure it's not sliding up. So we put it around our ankles, left leg back, and then up again. Tying the band closer together, just making it. Okay, and then we do the other side, 6 to 12 repetitions. And then we would take another break for 1 to 2 minutes, and then we would do a third set. Now, not everyone will be able to do a third set, and that's okay. We're going to remember our guideline of starting low and going slow. So if it's just 6 repetitions and 2 sets, that's fine. We all start somewhere, and over time, you should be able to increase how many repetitions and how many sets you're able to do. So I'm going to take this off, and then if you live somewhere with a gym or you have like a gym membership or something, then, there's also knee extension machines and you can kind of do it that way. Okay, next one. So there's many different ways to strengthen our hip abductors, and that's one of the muscle groups that I said was really important for balance. So we can actually keep it in a loop and then we just slide it up. And you can just bring it above your knees. So above your knees, but right above your knees. And then really simple, we're following just the middle diagram here, but you just will then spread the knees apart slowly and then slowly come together and spread the knees apart and then slowly come together. And again, we just do this 6 to 12 times. And then that's one set. And then we take a break for a minute or two. And then after we take a break, then we can do, a second set and then a third set. Now, if you don't have a resistance band, then there's ways to do this with just body weight. And this is an exercise you can do laying down, but you'd be laying down on your side. This is the far right picture, but essentially you'd be laying down on one side, and then you just bring your leg up and down. You would do 6 to 12 repetitions of those, and then 3 sets. It's probably for most people it'll be significantly more difficult if you're doing that exercise just because the resistance will be so much more. So uh, okay. Leg curls. Yes, sure. Yeah. Yes. No, you're right. So that's more of a medical school thing. So because there's abductors or abductors, which are going away. Then there's adductors or adductors that are inside that bring you back in. So we say abductors to differentiate because it sounds so similar to adductors, but it's like the opposite kind of muscle. So yes, yeah. Thank you for pointing that out. That can be confusing. Okay, so we can keep our loop here for the next leg exercise, and now we're going to get our hamstrings. So for this one, again, have it just down by the ankles, low on your ankles, and then you bring one leg forward, and then so you can bring your right leg forward, and then your left leg you bring backwards, and that's to get your hamstrings. And then you can do 6 to 12 of those, and you should feel it tightening up around the hamstrings. And then once we do 6 to 12 of those, and then if you're not getting enough range of motion, you can scoot up and then kind of get more. Might have to balance on your chair a little bit. Yes? No, you're going straight back. Straight back. And you should be feeling all the effort in your hamstrings. And then we do the other side. So left leg forward, right leg back, and feeling it in our hamstrings. And then we're getting, again, 6 to 12 repetitions. And then we're doing, again, 2 to 3 sets, just depending on how you're feeling with that. And if you have access to a gym, either in your home or in your community, there's leg curling machines that you could use to the same effect. Okay, we're not going to practice this one, but these are different exercises that you can do to strengthen the core. So essentially, yeah, the left side is showing a full low plank. I don't recommend most people do that. I do recommend starting with a plank on the knees. You do need like a pillow or something soft underneath your knees and your elbows. So I do recommend that people do this like in their bed, just because yeah, it can be painful if you're doing it on a hard surface. And then if that's too much to start out with, then I recommend you do hip bridges, where you're essentially just laying on your back with your knees bent, and then you lift your pelvis up and down, 6 to 12 repetitions, 2 to 3 sets. And you start wherever you are, and you slowly increase as you're able. Okay, moving on, we're going to arm strengthening exercises. So for this one, we can untie our resistance band. I think I tied mine a little too tight. Oh yeah, thank you. Okay, so yeah, sorry. Should have mentioned too, not super tight, but anyways, once you get it undone, you can step on. Okay, see, we're at different levels of getting there, but anyways, okay. So you essentially want to step on one end with your foot, you grab the other end, so it's hot, and then you pull up and you do a bicep curl. Oh yeah, that's true. You can also keep it in a loop. That's a good solution. And then you do, again, 6 to 12 repetitions. And then we switch sides. So then we would spawn it with our left foot and grab the end with our left hand. Make sure you're stepping on it really hard. If you're not stepping on it hard, it will snap up and hit you. So again, we're doing 6 to 12 repetitions. And then once we finish our set, then we take a 1 to 2 minute break. And then we can do a second set or a third set as our energy allows. Okay, so that's for your biceps. Now for your triceps, we got to be careful. Step on it. Hmm? Is it not working still? All right. So anyways, yeah. You have your elbows bent, and then we straighten out. Elbows bent, straighten out the elbows. Elbows bent, straighten out the elbows. And you're also pulling your arms apart. So elbows bent, straighten out the elbows and bend apart. And again, you should feel this in the back of your arms. Is where you should feel it tightening. Perfect.
Question.
Yes.
If you turn your hands the other way, is that strengthening some more in your biceps?
That's a good question. I don't know. The question was if you put your palms up, does that strengthen the same way or not? Let's test it out.
Biceps.
Yes, that is more biceps. You're correct. So yeah, your palm should be down. Okay. Now for our chest and back exercises here. This one's a little tricky. You generally have to find some sort of hook. So what I'm gonna do here.
Like the cabinet hook, or is that too?
Yeah, okay, so I can do this. Okay. So you're gonna have to get creative with this one, but you basically want to loop. I don't think anybody here will be able to do it, but I'll show you. You'd want to hook it against something. And then you're gonna make this taut and hope that it doesn't break off. Yeah, those hinges look pretty strong. I think we're good. Okay. And then we just row. Oh yeah, that's a good idea. That is a good idea. Okay, so yeah, you can put it through both. And then you want to pull your arms back, and when you do that, you're squeezing your shoulder blades together. So we're squeezing our shoulder blades together, then relaxing, and squeezing our shoulder blades together, then relaxing, squeezing our shoulder blades together, relaxing, squeezing our shoulder blades together, relaxing. This exercise and these back exercises are really important if you have history of like breast cancer or like head and neck cancer, because a lot of the people can get shoulder issues, and it's really important to strengthen the back muscles in those situations. Now, oh no, it does have to be hooked. It does have to be hooked on something. So, for example, I would like hold this for you. So now you pull straight back. Yes, exactly. Yeah. Yes. Yes. Exactly, and that's what you're going for. Perfect.
Sit door kind of.
Yeah, you can knot it around a doorknob, that's true. Yeah, or if you have like a towel hook or something, you could use that. Yep, we're almost done. Okay. Well, I think this is the last one. Okay, anyways, okay, chest press with resistance. So everyone can do this. This one's really easy. So you just put it around your back. Put it around your back, and then grab both ends, and then you just push forward. Push forward and sit up. Try to sit up straight while you're doing this one. Push forward. Push forward. You can have it behind the chair back also, but these bands are a little short, so it'll be better if it's just behind your back. Yep, just push forward, and that's it. And then you take a break after 6 to 12 repetitions, and then we go again for a second set, 6 to 12 repetitions. And then if we're feeling up to it, then we can try a third set. So that's for our chest and back. Okay, so those are basically all the exercises. If you need a place to start, again, you have your resistance bands. I would recommend, if you haven't been doing anything, I'd recommend just doing 3 exercises a day and just focusing on doing those exercises. So this is like a good place to start. Day 1, hamstrings, quads, balance exercises. Day 2, bridges, planks if you can, hip abduction, balance exercises. Day 3, biceps, triceps, rows, chest press. And these are all the exercises we just talked about. Day 4, you can just take it easy and stretch. And then you repeat, and you just go through days 1 through 4 again. Now again, and then the other thing is, again, if your balance is off, if you have a lot of fatigue, if you've never done this kind of thing before, talk to your medical team first, make sure it's okay for you. And then ask them if physical therapy would be right for you just to get started, because it can be really, really useful for, yeah, getting people to just the starting place. Anyways, thank you so much for everyone's attention. Be happy to take any questions. If you have any other questions, if I don't get a chance to answer you, this is my email address. Feel free to email me. Yes, in the back. Yes. Okay, so the question was, what is stroke volume? I mentioned that in a couple of different slides. Stroke volume is how much blood or the volume of blood that your heart pumps out to your body every time it beats. Yes, question in the front?
Can you speak on the benefits of isometrics?
Okay, the question was, can I speak on the benefits of isometrics? Yeah, isometrics, I would say, I would not, okay, so there's different isometric exercises basically means that for everyone else, you are not moving or changing the length of your muscle when you're exercising. So if typical, all the exercises we just did are basically concentric exercises where we're shortening the muscles. An example of the opposite would be eccentric exercises where we're letting the muscle lengthen. Now for concentric or for isometric exercises, you're just holding it still. You're just holding it in one place. Isometrics, I would say, are generally, some people say that it's better for building up like more strength. For yeah. Yeah. Yeah, or well, for tendons, they actually say that eccentric is the best. But isometrics, I can't say that they're necessarily better for one thing over general, like concentric exercises. But from the trainers that I've talked to, they feel like it's more beneficial for like getting your muscles like even stronger. So I'd say in general, it's harder to do when you're trying to maintain a specific position. So one really common isometric is like a wall sit, where you're basically just like, sitting against the wall like this. It's pretty tricky to do. I don't recommend it. And a lot of the research that I talked about, they were not doing isometric exercises in those studies. They were doing these kinds of exercises where you're doing like shortening of muscles, like with repetitions, like in different sets. So you can do it if you want to. I would say I'd not recommend it for most people because I think it's harder and probably more dangerous. Other questions?
Well, thank you so much, Dr. Chang, for your
Yeah.
presentation and for everyone for being here with us.